develop also frequently. That is what we call pressure areas. They are bony bone lenses that can easily develop get ulcer if you neglect them. So that is why if the patient is confined to bed, you are expected to be giving them special attention. That is what we call pressure areas. Is it clear? We have so many reasons for causes of disturbing factors to this pressure area. Pressure ulcer. One is moisture. If the skin is continuously in moisture, it can become irritated and pressure ulcer. Another one is friction. If there is any item that is creating friction between the patient's skin and the bed, it can also lead to the development of ulcer. Another one is what? Is the pressure itself. If the area is deprived of normal blood supply, before you know it, the area now can become wound. That is the ulcer now can develop. So these are the only factors that can lead to ulceration. That is why if you give care of pressure areas, you remove the moisture, you will leave the pressure, and if there is any friction, you remove it. If you can remember while discussing on bed making, we made mention of friction. That is why we even say that this surface, the seat, is not supposed to be coming in contact with the patient because it can create friction that can lead to ulcer. So no friction, no moisture, no excessive pressure. Now the wound will not develop. But if you neglect the skin, before you know it, within 1-2 days, the area will become white or flaky. That is ulcer now can develop. And that is the essence of giving this care of pressure areas. It prevents the area from developing what? Ulcer. So we have so many areas. The occiput is one of them. The shoulder blades is another area. The spine, that is the vertebral column, is another one. The sides of the hip is another area. The sides of the knee joint, the ankle joint, and the heel. And here, the sides of the elbow joint. As we said yesterday, under the pendulum, all these are areas that can develop also. And it's supposed to be giving the care of pressure areas. Is it clear? So these are the requirements for care of pressure areas. If you can remember yesterday, we already discussed on the procedure. But on the course of giving bed bath, you are doing two procedures together. You give the patient bed bath and you attend pressure areas. So that is why you can see almost all the requirements are the same. We have the towels, we have our own water. Only that in this procedure you don't have to come with any job. You just come with your mixed water. So this one is the powder and the salt. Sorry, let us come past it. Just take any container. We assume that it is
Don't.
So this one is our barrier cream. This one is the powder, this one is the soap, and these are the planters. Is it clear? So these are the requirements that we need for care of pressure areas. Care of pressure areas, if the patient is not critically ill, is one must procedure. But if the patient is critically ill or unconscious, so we need somebody to assist him. So now this is my assistant. The other side.
Critically ill.
What do you think are going to be the possible indications?
Unconscious patient.
Patients who are unconscious.
Patient who have stroke.
Either unconsciousness.
Critically ill.
Paralysis. Fracture.
Fracture. Critically ill.
Critically ill. Just like bed bath. Only that here we add patients who are overweight or obese. You understand? Patients who are overweight or obese. Sometimes even if they are not confined to bed, you see that they will be developing problems with their skin. So they are still to develop problems. Therefore, we give them special attention. So after explaining the patient, if the patient is conscious, now you come with your prepared way. So in here of pressure areas, we start from the back. As we did yesterday, you are going to remove all extra bed cloth and the patient cloth you remove. Is it clear? So now you put the patient on the back and you take your oil and you spread it here. Why are we using this oil? To avoid soiling the beddings. This one will be taken by my assistant. It will be used for drying. Then I take my flannel, as we did yesterday. I take my fork. And I wash the back using long straws, not circular. I will use what? Long straws. Wash the back thoroughly. Then as we did yesterday, you rinse. Right.
This is more than nothing more.
So now next is to give special attention to the pressure areas on the back. As you see, we have the shoulder there. We have the length of the spine.
No, the both. We want to compare it.
Yeah, the both of them
Okay.
are pressure areas.
Look at your mother.
So I'm going to them by putting the fork and you have it in circular.
Actually, if you're attending to the pressure area on its own,
Make sure that you stimulate circulation.
but when you want to do this site, you use
As we told you, pressure that stops circulation can lead to death stroke. So you put in circular way to make sure that you stimulate circulation. Clear?
Yeah. Where are you? That is Nigeria. I won't realize why they will do this thing. Where they are from?
As we said yesterday, if the patient is continent, you take your adjusting powder and you apply on the pressure areas. That is
And
if
some
the
of the
patient
time,
is
I'm bobo.
Is it clear?
Yes, sir.
If the patient is not continent, instead of powder, we apply barrier cream. Is it clear? Or Vaseline. Yes, Vaseline. Any Vaseline or any barrier cream. So especially people who are not growing long hair, as we say, hospital to another pressure area. If you are growing long hair, or like maybe female patient, in most cases, hospital is not a pressure area because the hair now is relieving the pressure. It's not likely to develop any infection because there is long hair. For people like me, or some who are using skin cuts, they are removing all the hair. Now the skin can be in contact with the matter and the dead skin. So in that case, you attend to the hospital. Do you understand?
Yes, sir.
The same way, this we are planning, rinse, apply soap.
Just leave it. One way of the
So as we did yesterday, you attend to the hand that is away from you. How do you do it? You just clean the pressure areas, you dry, you apply soap and rub it in circular way. You dry again. If continent, apply powder. If incontinent, apply Vaseline. When you come to the arm that is towards you and give the same treatment. When you come to the abdomen, as we said, it's only in female patients. The tenderness rest you attend. When you go to the lower limb,
and some young lady there. The one that
you start with the one away from you.
the young lady there, the one that
You spread the towel under it.
adult, so there's so much cost.
So here you give the same treatment. Under this you attend the side of the hip. You know, while cleaning the back you attend to the results. And now the side of the hip should be attended while attending the lower limb. You attend the side of the knee joint, you attend the side of the ankle joint and the hip. So that is what you have on the lower limb. When you cover the hip, okay, remove the towel. You cover the patient. You open the leg that is towards you. Your assistant now will put the towel. Take it back. Take your flannel again. Wash the areas. Dry. Then apply soap in circular way. Then you apply what? Either powder or Vaseline. Is it clear?
Yes. Somebody clear like morning.
So when you finish, you make your patient comfortable and you discard your material problem. Is it clear? But this one, sometimes it's only a tray procedure. You prepare your requirements on the tray. If it is a tray, you go and discard your any
During this procedure, can we use hand gloves or is not
I think that one yesterday we explained basically that these procedures are not sterile procedures. So basically, there is no need for hand gloves. But now with universal precaution, if you are doing any procedure that you will have contact with any fluid, it's allowed you to use gloves. So now sometimes, even for bed making, you can touch a linen that is wet, that is soiled by the patient's fluid. So even for bed making, you can use gloves. Any procedure that you can touch any fluid from the patient is allowed that you can use gloves. Okay, any other concern? Any other concern? No concern. So we need a copy to the